The thyroid gland is discussed in this screencast. You may find information on the thyroid gland in Chapter 9 of your textbook. This screencast was designed to achieve the following objectives. Describe the location of the thyroid gland. Describe a thyroid follicle. List the two thyroid hormones and describe the following. Stimulation of secretion, chemistry, hydrophilic or hydrophilic, target tissues and effects, and regulation. Explain the effects of hypothyroidism and hyperthyroidism, and explain why an iodine deficiency causes a goiter. The thyroid gland is found in the neck below the larynx, so it's easy to find the thyroid by simply putting your finger on the thyroid cartilage. The thyroid cartilage surrounds the larynx. You know it as your Adam's apple. And then just move inferiorly, and you will find the thyroid gland. The thyroid gland consists of two lobes, and those two lobes are connected by a narrow strip of flesh called an isthmus. The thyroid gland consists of structures called follicles. A follicle is a space surrounded by a single layer of follicular cells, and in this space we have a viscous fluid called colloid, and it is within this viscous fluid that thyroid hormones are synthesized. Thyroid hormones are unique in that they are the only hormones that are synthesized extracellularly, that is, outside of cells. Thyroid hormones are amino acids modified by the addition of several iodine atoms. So they are hydrophilic hormones. There are two major thyroid hormones, thyroxine or T4, which contains 4 iodine atoms. Thyroxine represents 90% of the thyroid hormones released by thyroid gland. Triiodothyronine or T3 represents the other 10% of thyroid hormone released by the thyroid gland, and it is much more potent compared to T4. One of the reasons why iodine is a required nutrient is because it is one of the building blocks of the thyroid hormones. In fact, 80% of the iodine in the body is found in the thyroid glands. Thyroid hormones target every tissue and every cell of the body. Even though thyroid hormones are modified amino acids and therefore hydrophilic, they actually bind receptors inside of their target cells, and that's because there are specific channels that allow T3 and T4 to enter the cells and bind intracellular receptors. Thyroid hormones, after binding receptors inside their target cells, increase the production and the use of ATP by those cells, and this increases the amount of energy required just to maintain life, or what is called the basal metabolic rate. So thyroid hormones overall increase the basal metabolic rate. They also reduce the efficiency of ATP production, causing a greater amount of energy to be lost as heat in the production of ATP. So thyroid hormones increase the amount of heat produced by the body. Thyroid hormone also makes tissues more sensitive to sympathetic nervous stimulation. Thyroid hormones increase the heart rate, and they also increase respiration rate, both associated with sympathetic nervous stimulation. Thyroid hormones are essential to the normal development and maintenance of tissues, particularly those tissues that are highly metabolically active. Highly metabolically active tissues require a lot of ATP in order to do work. Thyroid hormone stimulates the production and utilization of ATP by cells. So those highly metabolically active cells require thyroid hormones in order to obtain the ATP that they need to do work. Two organ systems that are very metabolically active and are negatively affected by insufficient levels of thyroid hormones are the nervous system and reproductive systems. In order for normal prenatal development, that is, development prior to parturition or birth, as well as postnatal development of the nervous system, there must be adequate amounts of thyroid hormone. Also, in order for normal development of the reproductive system and maintenance of the proper functioning of the reproductive system, there must be adequate levels of thyroid hormones. So although I have highlighted the reproductive system and the nervous system, normal fetal development and growth of all tissues in general require adequate amounts of thyroid hormones. So you can see that thyroid hormone plays a vital role in the growth, development, and maintenance of all the body's tissues, but in particular those tissues that require the most ATP or energy. Now let's talk about what stimulates the secretion of the thyroid hormones T3 and T4 by the thyroid gland. Well, it all starts with the hypothalamus. The hypothalamus produces a hormone called thyrotrophin releasing hormone, and this hormone targets the anterior pituitary gland, causing the anterior pituitary gland to secrete thyroid stimulating hormone. As its name implies, the thyroid stimulating hormone targets the thyroid gland, causes the thyroid gland to enlarge and produce the thyroid hormones T3 and T4. Although T3 is the more potent form of thyroid hormone, 90% of the thyroid hormone is in the form of T4. T4 is converted to T3 by the target cells. Thyroid hormone secretion is regulated by classic negative feedback. As T3 and T4 levels in the blood rise, they inhibit the further release of thyrotrophin releasing hormone by the hypothalamus, and they also directly inhibit further release of thyroid stimulating hormone by the anterior pituitary gland. Hyperthyroidism is the hypersecretion of thyroid hormones. In other words, an abnormal elevation in the release of thyroid hormones by the thyroid gland. In some cases, a goiter or enlarged thyroid gland may be present. There are numerous causes of hyperthyroidism. You could have a tumor of the thyroid gland. There can be some substance that is causing the thyroid gland to enlarge and to produce an unusually large amount of thyroid glands. If someone doesn't produce enough of their own thyroid glands and they are overprescribed exogenous thyroid hormone, that also can cause hyperthyroidism. What do you think the effects of hyperthyroidism would be on the body? Well, just think about the effects of thyroid hormone. Remember that thyroid hormones increase the sensitivity of the body to sympathetic stimulation. So someone with hyperthyroidism tends to be nervous and jumpy. They may also exhibit tremors. They may have an increased heart rate and an elevated blood pressure. Because of the effects of thyroid hormones on increasing the production of heat, they will tend to be hot and sweaty. They may in fact be hot while others around them are comfortable or even cold. Individuals with hyperthyroidism may also exhibit unexplained weight loss where they are consuming their normal diet, haven't cut back on the calories they consume, but yet lose weight. And this is due to an increase in the basal metabolic rate that's associated with an increase in thyroid hormone secretion. Hypothyroidism results from the hyposecretion of thyroid hormones, or in other words, a below normal release of thyroid hormones from the thyroid gland. If an iodine deficiency is the cause of the hypothyroidism, in other words, if the body isn't receiving enough iodine to meet the requirements of normal production of thyroid hormones, an enlarged thyroid gland or goiter may be present. Because thyroid hormones are required for the normal growth and development of tissues and organs of the body, hypothyroidism can impair growth and development not only in a fetus but also in young children, since young children are growing and developing quickly. Effects of hypothyroidism are the exact opposite of the effects of hyperthyroidism on the nervous system. Someone with hypothyroidism would have a very sluggish nervous system. Their reflexes would be underactive. They would be slow and lethargic, and they would be sleepy and fatigued all the time. They would also have a low heart rate and a lower than expected blood pressure. Individuals with hypothyroidism tend to be cold intolerant. That is, they tend to be cold all the time, even when individuals around them are comfortable or even hot. Hypothyroidism results from hyposecretion of thyroid hormones. In other words, in a below normal level of secretion of thyroid hormones. If hypothyroidism is due to an iodine deficiency, where the individual is simply not consuming enough iodine to meet the requirements of thyroid hormone production, a goiter may be present. And we'll talk in a moment about how an iodine deficiency causes the enlargement of the thyroid gland. Because the nervous system and the reproductive system and other tissues of the body are so dependent on thyroid hormones in order to generate the appropriate amounts of ATP for growth and development, hypothyroidism can impair growth and development in not only a fetus but also in children, since children grow and develop rather quickly. The effects on the nervous system are, as you would expect, the opposite of the effects of hyperthyroidism. Here we get a sluggish nervous system with underactive reflexes. The individual is lethargic. They tend to be very sleepy and fatigued all of the time. Also, they will tend to have a low heart rate, low blood pressure. They will tend to gain weight, and they will tend to be cold all the time when other people around them are comfortable or even hot. This figure from your book illustrates the effects of hypo and hyperthyroidism. The effects of hypothyroidism are illustrated on the patient's right, and the effects of hyperthyroidism are illustrated on the patient's left. Now let's talk about iodine deficiency and how an iodine deficiency can cause the development of an enlarged thyroid gland or goiter. This individual here has a very pronounced goiter. Recall that the release of T3 and T4 from the thyroid gland is under the control of a negative feedback mechanism. As T3 and T4 levels rise, they reduce further release of thyrotropin releasing hormone and thyroid stimulating hormone. In the case of an iodine deficiency, there is not sufficient iodine to make the normal levels of T3 and T4. So levels of T3 and T4 in the blood are very low, and there's little or no feedback onto the hypothalamus and anterior pituitary glands. Therefore, there is significant release of thyrotropin releasing hormone and thyroid stimulating hormone. The result is an enlargement of the thyroid in an attempt to stimulate the thyroid gland to produce more T3 and T4. However, because of the lack of iodine, it is not possible for the thyroid gland to make more T3 and T4, even if it grows and enlarges. So T3 and T4 levels remain low. There is little or no feedback onto the hypothalamus and anti-pituitary gland. Therefore, there is continued secretion of thyrotropin-releasing hormone and thyroid-stimulating hormone, causing the thyroid gland to grow larger and larger, and therefore we have the development of a significant goiter. Now let's review the objectives of this screencast. Describe the location of the thyroid gland. Describe a thyroid follicle. List the two thyroid hormones and describe the following: stimulus of secretion, chemistry, target tissues and effects, and lastly, regulation. Explain the effects of hypothyroidism and hyperthyroidism. Explain why an iodine deficiency causes a goiter. Calcium homeostasis is the topic of the next screencast.